Hello everyone, welcome to the channel GDC English. My name is 𝙂𝙋𝘼𝙎. In this video, we're going to learn the effects of various drug on the eye. That must be interesting, no? So let's understand what is meiosis and mydriasis. Okay, so what are these terms called for? Okay, so meiosis is just simply the contraction of pupil. Okay, the pupil size will be decreased at the time of meiosis, whereas mydriasis just reversible dilation of pupil. Okay, pupil, that is eyeball generally, no? So let's understand the structure of eye, not that bio diagram. Let's understand this one. Okay, so this is an eye, whereas these round ones is the circular muscles. Okay, circular muscles, and this one are the radial muscles. Okay, so what are these muscles? These muscles are of iris. Iris have two muscles. Okay, so these two muscles are circular muscles or radial muscles. Circular muscles and radial muscles. Circular muscles are also known as the sphincter muscles. Okay, now let's understand the connectivity of these muscles, connectivity with the receptors. Okay, now the circular muscles having M3 connectivity. M3 means muscarinic third receptor, whereas radial muscles have alpha 1 connectivity, alpha 1 receptor. Okay, let's now understand what is the downstream signaling of these M3 and alpha 1. We do have M3. So it is which kind of mediation? It has GQ mediation. Whereas alpha 1, it is also has GQ mediation. Now we having circular muscles over here, these ones. Okay, and radial muscles over here. This is your pupil, through which doctors can see through the retina also. Okay, so by the dilation purpose only, the doctors or ophthalmologists can see your retina. They can easily check your eyes through dilation process, and these dilation of pupil are known as the mydriasis. Okay, now we do have some terms, right? Meiosis and mydriasis. Okay, so let's now understand what is active meiosis, what is passive meiosis, what is active mydriasis, what is passive mydriasis. Okay, so first we need to learn that contraction means, we need to learn that meiosis is contraction and dilation is mydriasis. Okay, now let's take the first condition. First condition we are having on the circular muscles, right? Circular muscles have M3 connectivity. Okay, so let's give a M3 agonist. Okay, let's give a M3 agonist. So what will this M3 agonist do? It will activate the M3 receptor and will leads to a contraction. Okay. Now this contraction will leads toward what? This contraction will be leads towards the decrease in pupil size. Decrease in pupil size. So what is actually happening here? When your pupil gets contracted, having decreased size, then that term is known as Miosis. But which meiosis? It will be a active meiosis. Okay, this will be a active meiosis because it is happening on the M3 receptor only. It is getting activated by M3 agonist and gets contract the circular muscles, and this will lead to the decrease in pupil size, which is ultimately leading towards the active meiosis. Okay, let's move towards the second one. Now we will give the M3 antagonist. Okay, so what will happen here? The M3 antagonist will do what? M3 antagonist will do what? There will be a relaxation, no? Relaxation. Sorry. So there will be a relaxation. Relaxation means this side. No, so this side, what will happen? There will be a dilation. Relaxation or dilation. Dilation. There will be increase in pupil size. So there will be an increase in pupil size, but it will be called as increase in pupil size will be mydriasis, but it will be of passive mydriasis. Okay, because it is happening indirectly. We are targeting M3 receptor only, but M3 receptor is generally responsible for the contraction. But here, if when we are giving the antagonist, that is responsible for the relaxation purpose. Relaxation purpose will be responsible for increase in the pupil size. Increase in the pupil size. That increased pupil size will be termed as the mydriasis. Okay, we have went for the contraction purpose, but what is happening now? It is happening a mydriasis in a passive way, in the indirect way. So the indirect way will be a passive mydriasis. Okay, so now let's move towards the third case. Third case. Now we are having radial muscles. Radial muscles. Okay, which we have alpha 1. Alpha 1 GQ mediated again. Now in the same way, when we given the alpha 1 agonist, what will happen? Alpha 1 agonist will do the contraction of radial muscles. Radial muscles. So these are the radial muscles. No. So if these muscles will be contract, what will happen? There will be a dilation. There will be a dilation inside the pupil. Suppose you are having this as a radial muscle, but when you are giving a alpha 1 agonist as a contraction, it will be this side. It will be doing this way. So it will be if it will be doing this way, what will happen there? There will be a dilation process will be in the pupil. So that will lead to the increase in pupil size, which will be called as dilation. So dilation will be called as the mydriasis. Mydriasis. That will be a active mydriasis. Okay. Now, fourth condition. Fourth condition is same way we have taken the radial muscles. Now alpha 1 antagonist we have given. Alpha 1 antagonist we have given on radial muscles. So that will be responsible of the dilation of radial muscles. No. Dilation of radial muscles. Now the dilation of radial muscles will do what? This will do dilation will be extended towards the pupil also, na? So that will be responsible of the constriction of pupil side. So if there is a constriction, what term we will use? We will use miosis. And that miosis will be the passive miosis. Okay, so these are some terms, that is you should learn that how it came. So this is the process. These are the mechanism through which these terms have been came in the eye, that is effects of drug on eye. First one is active meiosis, second one is passive mydriasis, third one is active mydriasis, and fourth one is passive myosis. So this is all about the video. I hope the made you clear about this topic. So stay with GDC.